A matter of perspective. When we give our opinion about something, we call it sharing our perspective. It means to show what things look like from a particular point of view. If you're the top dog looking down, you will have a different perspective than you would if you were the runt of the litter looking up. I'm certainly not the top dog, so I can't say much about how things look from the point of view of this man. Stephen J. Hemsley, CEO of United Health Group. That's a company that sells medical insurance for profit. Currently, they are paying Hemsley a one-year compensation package of $102 million. To put that in perspective, his annual package is about enough to pay the yearly salary of every member of the United States Congress, both the House and the Senate. That may seem like a lot of money to pay one person for anything, but that's just the tip of the iceberg. The shareholders of United Health Group are willing to pay Hemsley this lavish compensation package because of the company's ever-rising profit margin. It was reported that their first quarter profits for 2011 have exceeded their first quarter profits for 2010 by 13%. Likewise, other insurance giants like Aetna, Humana, Coventry, WellPoint, and Cigna are posting big profits these days. The way these companies make these hefty profits is simple. They take in far more in premiums than they pay out, and they manage that in a number of ways. One is simply to deny as many claims as they possibly can. Another is to shift their policyholders into high-deductible plans that force them to pay large sums out of pocket before their coverage actually kicks in. My employer-based plan is like that. Last year, the coverage paid 100% after the $5,000 family deductible. Next year, that will drop to 80% coverage after the $5,000 family deductible. They tell us it's because of increasing healthcare costs and because of government regulation. For some reason, though, I can't help but eye those ever-rising profits with suspicion. Now, meet Larry. He is a personal friend and co-worker of mine. He has 2 grown sons, and he supports himself and his wife on a salary of about $43,000 per year. About 9 months ago, Larry's wife was diagnosed with cancer. So Larry shelled out $2,500 to meet her portion of the deductible for her chemotherapy and radiation treatment. Unfortunately, Larry was also developing some serious health issues that resulted in a lot of missed work days. He needed some expensive tests done, but he put them off for the past 9 months because he couldn't afford another $2,500 deductible, along with the pay he'd already lost for missing so much work. Finally, he got the testing done, and he's got stage 3 colon cancer. And do you know what he told me? He said, "I'm not nearly so worried about the cancer as I am about how I'm going to pay for all this shit." His sons have been helping him out with the bills. Without them, he and his cancer-stricken wife would have already been out on the street. And you know what I think is funny about this? Not funny ha-ha, more like funny what a bunch of shit. We're lucky because we have insurance. A lot of people don't even have that. Now, I have some Republican friends who really like these high-deductible plans. They like them mainly because the premiums are lower than the standard PPOs and HMOs, and they only have to pony up the deductible if they have some serious medical issues. Okay, I get that. But here's something I don't think they get. Some of these Republicans I'm talking about make a lot more money than my friend Larry. So for them to come up with $2,500 for medical expenses isn't all that hard to manage. They really don't have much empathy for people like Larry, who put off his colonoscopy for 9 months so he could continue to pay his bills. To put it in perspective, remember that word? Let's use the salary of a U.S. congressman as an example. For my friend Larry, making $43,000 per year, $2,500 is roughly 6% of his annual income. But if a member of Congress making $174,000 per year had to pay 6% of his gross income before his insurance kicks in, he'd be on the hook for $10,400. And I don't think he'd be nearly so keen on his medical coverage if that were the case. Right now, the Republicans are hell-bent on repealing the Affordable Health Care Act, or as they like to call it, Obamacare. If they succeed, we will lose what meager protection this act extends against the unconscionable actions of insurance companies. Insurance companies will continue to deny coverage for pre-existing conditions. They will continue to drop people from coverage when they get sick. They will continue to charge higher rates for small businesses than for corporations. In other words, it will continue to be business as usual for the insurance companies, excluding the highest risks and gouging the rest in order to pay men like Stephen Hemsley $100 million per year. And the Republicans will say that's a good thing, and I'm sure Stephen Hemsley agrees. But it doesn't sound so great from my point of view. The way I see it, the American healthcare system has been a lot more beneficial to people like Stephen Hemsley than it has to my friend Larry.